Hello, I'm Claude Rafin, Managing Director of the INS Group. Over the past couple of years, our team at INS LifeGuard has been working on something groundbreaking. Not just an app, but a complete health, safety and wellness solution for your residents, staff and community. It's called INS LifeGuardian. Before launching, we ran a comprehensive pilot program with real users across Australia, residents in retirement villages, people with complex conditions, and even frontline workers. Our goal? To understand how technology, combined with real nurse support, could genuinely improve lives, not in theory, but in practice. The results were powerful. People told us they felt safer. They discovered health issues they weren't aware of. Families felt reassured, and importantly, they wanted to keep using it. As impressive as the feedback was, it's not just statistics. Behind these numbers are people whose lives changed thanks to early detection, fast intervention, and compassionate care. I'd like to share just a few of their stories. While the stories you're about to hear are portrayed by AI-generated characters, the experiences they share are real, drawn from genuine feedback by LifeGuardian users.
I was doing all the right things, staying active, I even attended Pilates, but I was still losing confidence in my balance. Then, a serious fall in the backyard left me with a shattered shoulder and weeks in hospital. It was a long road to recovery. But now I've got INS LifeGuardian on my Apple Watch, and it's really helped me regain that lost confidence. I don't think I could live without it now, to be honest. My family feels better knowing they can easily check in and stay connected, and they know I've always got help when I need it, wherever I am.
I've been living with atrial fibrillation for a while, and I've had a good cardiologist looking after me. But even with that, INS LifeGuardian kept picking up heart rate readings from my Apple Watch that were higher than normal. After a nurse review, INS LifeGuard sent a clinical report to my cardiologist. At first, it didn't raise major concerns, but the team kept an eye on things with monthly reviews. When those high readings stuck around, my cardiologist ran a 24-hour Holter monitor test, which confirmed what the INS LifeGuardian app had been flagging, which led to a change in my medication. Since then, things have been much better. My nurse reviews show my heart rate is staying in the normal range. It's reassuring to know I've got ongoing monitoring by real nurses.
I'd been feeling constantly exhausted, even after a full night's sleep. I didn't think much of it, just figured it was part of life. But my Apple Watch and INS LifeGuardian had been tracking something I wasn't aware of: overnight drops in my health stats. One of the nurses, Shay, noticed a pattern in my data and reached out. She put together a detailed report and sent it to my doctor. That triggered a bunch of tests, and it turned out I have mitral valve regurgitation. Totally unexpected. They are monitoring that now, and I've had changes to my medication. But they are also monitoring me for strange early morning dips in heart rate and blood oxygen, something else the app picked up. Honestly, if it weren't for the INS LifeGuardian app and the team behind it, I'd still be dragging myself through each day, thinking that was normal. I'm so grateful that INS LifeGuard was watching out for me.
Let me share the story of Margaret, a powerful example of how the INS LifeGuardian app can quietly work in the background, protecting lives. In July 2024, we received an ECG alert from Margaret's Apple Watch, showing signs of atrial fibrillation. One of our nurses contacted her right away. It wasn't the first time we'd seen that pattern. We'd flagged the same reading previously, but she hadn't had any symptoms at the time, so we continued to monitor. This time, during the call, our nurse asked Margaret to run another ECG. Again, it showed AF. She still wasn't experiencing any classic heart symptoms, but she admitted she wasn't feeling quite right. That was enough. Our nurse urged her to see a GP immediately. Margaret followed that advice, and it's a good thing she did. The GP confirmed she was in AF and called an ambulance on the spot. She was taken straight to hospital for urgent care. Her husband called us later to share how grateful he was. The system had caught something they would have otherwise missed. Then, in January 2025, we saw another warning sign. One of our nurses noticed Margaret's heart rate had dropped to 36 beats per minute, and it stayed that low for a worrying amount of time. She had already spoken with Margaret during a previous review and knew she was on several heart medications. She urged her to see her doctor without delay. That intervention may have saved her from something far more serious. At the heart hospital, they discovered her medication dosage was too high. It was slowing her heart and damaging her kidney function. She was admitted overnight, treated with fluids, and her medication was adjusted. Margaret's experience is just one of many that show the real-world impact of this technology, not in theory but in people's lives. And we knew we had to build on that. Since the pilot, we've made major strides to enhance the user experience and extend access. We're not done yet. The future of INS LifeGuardian is bold, and it's already in motion. Each new feature adds layers of care, control, and confidence. INS LifeGuardian isn't just protecting lives, it's restoring independence, empowering carers, and transforming how communities stay safe and well. I invite you to explore how this solution can support your organisation. Let's trial it together and shape the future of connected care.